Hi, I want to thank you for choosing my pain therapy system. Let me show you how to use it. Now you may have a device that's of a different model and it may look slightly different, but don't worry, the usage is the same, so you can just follow along. Now first of all, you need to put batteries in. Okay, so just open up the back, and I suggest you use alkaline batteries and not the rechargeable ones, because alkaline batteries will give you a nice steady power and it makes the device more effective. Okay, and this thing uses very little power, so even if you use it every day, it will last you 1 to 3 months, so very good, and it's totally portable. Now, next thing you do is to plug the electrodes in, so open up the wires, and then to plug it in, it's very simple. Take the electrode and the wire and push them together, just like that. Okay, and now we want to plug the wire into the device. So find the hole and push the plug in all the way, okay? And if your plug have a little different look, don't worry. Again, they all work the same, but we just have different style. And now you're ready to go. Now, what you do is peel the electrodes off the protective gel. And those are self-adhesive electrodes, so you don't need to add anything to them. They're self-adhesive. So just put on the area where you want to get a treatment. And make sure your skin is clean. If you have any lotion, oil, or makeup on your skin, clean your skin first before you put the electrode on. Now this is a very powerful little device. Okay, so what that means is always turn on very slowly. Don't just ramp it right up. So there's a little dial here. We just click it on. And one word of advice: always do the control yourself. Don't let someone else control the intensity. Otherwise, they can turn up a lot and you'll find it too strong. So slowly turn it up until you feel the stimulation. Ooh, that feels good. Okay, and you want to turn up to a point where you actually feel the muscle contracting and relaxing. It's almost like the muscle's dancing. And what you find is, every few seconds, it'll stop and change to a different stimulation. And that's normal. In fact, that's very unique about our device. And because it's always changing, your body don't get used to it. That's why it is so effective. All right? Now, there's 3 different modes. And you can press this button here to change the mode. Each mode contains a whole different group of treatment. And they all feel different. So you can select the one that gives you the most comfort. Now, the effects are the same. Basically, this device helps to relax your muscle, to relieve any muscle tension you have. Help to improve the blood and nerve circulation. Okay, very good for anybody with numbness or circulatory problems. And also help to relieve your pain. Okay, so it doesn't matter which mode you select, you can get the same results. Now there's also a timer here. Let me turn it down so I don't have to hold the device more steady. Okay, there's a timer here, and this timer is very good to use, especially before bedtime. So you can use the device and set the timer for anywhere from 20 to 40 minutes, and the device can give you the massage you need while you're falling asleep. And after you fall asleep, the device will shut itself off. Now, you should use the device at least 20 minutes each time, and 3-4 times a day if you have a chronic type of condition, okay, until you reach your maximum recovery. We find that at least 20 minutes will give you a measurable improvement, but you could use it longer. There's no harm in overusing it. There's no medication, no drugs, so you can use it as long as you like, okay? And the more you use it, the more effective it is for you. Okay, so that's the basic usage. And when you're done, just turn it off before you take the pads off. Oh, by the way, if you do run through the time and the device shuts off, you need to turn it off, okay, by all the way and click it. And then if you want it back on, you have to click it on, okay? So if the timer, stops the machine because the time runs out, you find no more stimulation, you have to turn it off completely and then turn it back on in order to get the stimulation again. That's important for you to remember. Okay, so that's the basic operation of this device. One thing you should know, you could have 4 pads going at the same time, so I could actually plug in another set of wires with 2 additional pads. And also, you need to have 2 pads on your skin at the same time. If you just have 1 pad, it will not work. And if you do use 4 pads, make sure the 4 pads are of the same size. And also, if you use the foot massage pads, use the foot massage pads alone. Do not mix the foot massage pads with the other pads because they have different resistance, so they feel different. Okay, so use the foot massage pads alone. Those are some of the basic usage that you should know about this device. My pain therapy system is safe to use even if you have diabetes and if you're on other medication already, because there's no chemicals involved, so you can use it safely as often as you like, for as long as you like, with no side effects and no worry, just feeling good. Now let me show you how to take care of your pads. When you finish with the treatment and you want to take the pads off, do not pull on the wire, because if you pull on the wire, it'll make this come loose and then the pads won't work. So grab the pads and pull it off your skin. And always make sure your skin is clean before you put the pads on. So if you have lotion or cream or makeup, clean your skin first. After you take the pads off, don't put it down on the table because the adhesive pad itself will pick up all the dirt. So always put it back onto the protective gel that comes with your system. Okay, and then put it back into the bag. Now, couple things. If you find the pads don't stick as well as you like, or you find it's starting to give you pins and needle sensation, that means the pads are too dry. So you need to moisten them. So get yourself a glass of water, dip your finger in the water and just rub some water over the gel surface. For about 10 to 15 seconds, the moisture will be absorbed by the gel and then the pads will be sticky and conduct better right away. So very simple. Now those are disposable but reusable pads. You can reuse them about 100 times, sometimes a little bit more, sometimes a little less, depending on your skin condition. If you find they don't stick anymore or they don't feel good, it gives you, pins and needle sensation, then it's time to put new pads on. Now to change to new pads, you just pull the wires apart, get yourself some new pads or new electrodes, and just simply plug them in just like that. And you're ready to go. Very simple. Now the foot pads, if you have these, okay, those do not need to be replaced. They will last you a lifetime. So they're fantastic. And if you do find them don't conduct as well as you like because you got very thick skin on the sole of your feet, or if you happen to have some kind of neuropathy from diabetes or severely pinched nerve in your back, say your feet's all numb and you don't feel the sensation, one thing you can do to improve the conduction is you can actually put a little water either on the bottom of your feet or on the foot pads themselves, and that'll help to make the conduction better. Okay, so that's another tip for you. So take care of your electrodes and it will take care of you. If you suffer with migraine headaches, tension headaches, if you have neck pain or shoulder tension, then watch this segment very carefully. Now I've been in practice for over 20 years. I've treated many patients with similar pain with great success using the pain therapy system. In fact, most of what I know before and most of what you know about headaches is probably not correct, okay? What I find is most headaches, most people who suffer with tiredness or that constant band of tightness on their forehead, most people who get dizziness have some problem with the neck, whether they have neck problem or not. So if you have any kind of head problem, meaning dizziness, fatigue, you have trouble sleeping, and if you get headaches, make sure you treat the upper part of your neck. That's very important, and most doctors will not tell you that because they don't relate to that and because they haven't discovered the truth yet. Now, to treat the shoulder and neck area, you can use 4 pads, okay? So 4 pads at the same time. So I always like to put 2 pads on the upper shoulders, and then I use the other 2 pads on the area of the neck where I have problem. So if you have pain in particular area of your neck, just put the pads right on it, just like that, okay? But if you have headaches, like those throbbing, pounding headaches, that stabbing pain behind the eyes, or if you're constantly tired, then you need to put the pads just below the hairline. For migraine patients, this is very, very important, all right? So put the pads right there, just below the hairline. If you feel it, there's a little depression there, that's where the nerve exits. From my experience, and I've treated many, many people with migraines and other types of headache, over 90% of patients who get migraines, if they get a treatment here, they can get great relief, and we have seen many people who don't get headaches anymore if they treat themselves regularly, all right? So put the pads there. Now, one word of advice. When you're treating your neck, and if you're getting treatment for headaches, you have to lie down. If you do a sitting up or even semi-inclined, you don't get the same results. The reason is your head weighs about 10 to 12 pounds. So if your neck have to hold the head up, then the muscle cannot relax. So you have to be in a total relaxed position for your neck. So I'm going to lie down to show you exactly how to do it. Now this is the correct position to treat your neck and to treat your headaches, okay? You get yourself a neck roll. If you don't have a neck roll, just get a bath towel, roll it up, and you want to put the roll under your neck, not under your head, because what we want to do is support the neck in its neutral position so it can relax better. And also we want to use the roll to press the pad tight against my skin so that you get good contact and a better treatment, all right? Now, I already have the pads on my neck and on my shoulders, 4 of them. And I'm just going to lay on this neck roll. And then you just turn this on. And I love this treatment. I do this almost every night because I spend a lot of time in front of the computer. So by the end of the day, my neck is a little tense. So I put this on so that I don't get any problem the next day or accumulating muscle hardening. So you just turn on and it feels good. It feels like somebody's massaging you, chopping you, relaxing you, and you get better circulation. And in about 10 or 20 minutes, you'll feel that better circulation going to your eyes. And if you have any headaches, you'll find them start to diminish. This really works, okay? If you have neck pain from a whiplash, like car accident, or from working in front of a computer, or if you got wry neck, okay, say you woke up one morning and you got a really, really stiff neck, you can't turn your neck at all, put this on. This will help you, but you have to do it in a lying down position. Now also, if you tend to have more headaches, or more neck pain in the morning, put this on before you go to bed. Or if you have trouble sleeping, put the pads on the top of your neck. It also helps. Now, do set the timer, and I will set it for like 20 to 40 minutes. And then this will give you a continuous treatment, continuous massage until you fall asleep, and it'll shut itself off. So you're going to really enjoy this treatment, and you're going to have less headache and less neck pain by using it regularly. Take care of yourself. Now, for those of you who suffer with migraine headaches, tension headache, or if you have neck pain or tension in your shoulder, I suggest you do the following exercises, okay? It's very important to keep your neck nice and loose and to have full range of motion. So the way to do it is you just stand up, okay, with your arms down, nice and relaxed, and just turn your head from side to side about 20 times. And do it in a fairly rapid motion so that the joints can actually become more loose with each turn. So this is what you do. Just nice and loose, and let the momentum of your head carry your neck motion, okay? So, just like that. Now, if you do hear a little bit clicking noises, that's okay. It's just the joints starting to get some new range of motion, so nothing wrong with that, okay? Now, I suggest you do not stretch your neck like this, okay? Or like this, which, you might be taught, or any of those other motion. All I suggest you do is rapidly turning your neck from side to side, okay, about 20 times, and do that 2-3 times a day. First thing in the morning, before you go to bed, also when you're taking a hot shower, okay? Also, if you're the type of person that sit at a desk and work on your computer, make sure your computer's right in front of you. if your computer's on the side, you're turning your neck this way, or if you're watching television this way, your neck can tighten up very quickly. So always work with you facing, or whatever your task is. That's very important. And then if you do work, if your work causes a lot of stress in your neck and shoulder, do stand up once in a while and just do some rapid motion with your neck. And that will really help with the neck range of motion. Now, you need to strengthen the neck and shoulder muscles, because as you work on a computer, or if you're doing things with your head down, the neck and shoulder muscle, they get strained with time. And when they get strained, they get shorter, they get tighter, and they start to pinch a nerve. So it can cause local pain and referral pain. And that's why many people get headaches. So I'm going to show you how to do some exercise to strengthen your neck and shoulder muscles. Now, if you do suffer with headaches, neck or shoulder pain, you should be doing some push-ups every day. I suggest you do it first thing in the morning, and even maybe before going to bed. Now, doing push-up helps to strengthen your neck and shoulder muscle, plus it helps to improve your posture, so you're not hunching over, because the hunching over posture is very hard on your neck and shoulder muscles. Now, if you have not done any push-ups for a long time, don't worry. I'm going to show you different ways of doing push-ups so that everyone can do them. Now, if you have trouble doing regular push-ups, do it against a counter. So a kitchen counter, bathroom counter, or even your desk. Just make sure it's solid and it doesn't move. So this is what you do. Just put your arms about shoulder width, okay? And then just going down like that and pushing up. And you can change the amount of resistance by changing your angle. So if you want it easier, you stand more upright. You want it harder, step back a little bit, and then you have more resistance, okay? Now, one thing you should always do when you're exercising, you should breathe out on exertion. So as you push up, you go. Okay, just like that. Now, I suggest you start with 10 each day, okay, and then move up to 20, and then move up to 30. If you could get up to 30, each time, and do that at least once or twice a day, then you can move on to the next phase, to even get stronger. Now, the second way of doing push-ups is to do on your knees. So put your arms about shoulder width, okay? Now, your back should be pretty straight. You don't want to be doing this. So back stay straight and just going down. And breathe out on the way up. So, again, you want to start with 10 a day, then work up to 30 a day, or 30 each time, and you can do a couple times a day. All right? When you can reach the level where you can do 30 each time, then you go into the next step. Now, the third way of doing push-ups is to do what I call regular push-ups. That is, you're on your toes, your back straight, your arms about shoulder width, okay? You go down and you breathe out when you exert, so you breathe out on the way up. Now, this is the correct way, meaning my back is flat, it's straight. You do not do this. Okay? You start raising your butt up, that's using the wrong muscles, and it's not good for your back. So I want you to keep your back straight. Just like that, okay? Now, what I suggest is you start doing 10 at a time, 2-3 times a day, and work up so that you can eventually do 30 at a time, all right? And when you do that, you have stronger neck and shoulder muscles, less headaches, and better posture overall. Now, if you do have a spot pain between the shoulder blades, which I know some of you may have, okay, or you find yourself always slouching over, here's an exercise for you. What you do is just point your fingers towards each other. Breathe in really deeply to expand your rib cage, to expand your chest. So, okay, so breathe out on the way back. Breathe in, expand, extend your chest. So I'm moving my rib cage. I'm bringing my shoulder blades together. I'm also stretching my chest muscles and opening up the rib cage. Try breathing through your nose as well. Okay, do that about 10 or 20 times whenever you feel there's a need. Now, if you have headaches, neck pain, or circulation problem with your arms, then there's another product you should be using together with the pain therapy system. Okay, it's called the neck comforter, and you can find out more on our website. Now, just quickly show you, this is a neck traction device. So basically, you put it on, and it works by air. So we just close up the valve, and we just pump it up. And when you pump it up, what it'll do, it'll lift the weight of your head off your neck, okay, to help give your neck good support. But more importantly, it helps to lift and stretch the neck muscles and press the shoulder down. So let me just pump it up first. So first, I'm feeling right now just like my head is getting a nice little lift. Now you don't stop there. It's not just a neck support. It actually stretches your neck. So you keep pumping until you feel, okay, that's good, okay? I can now feel my shoulders being pushed down and my neck muscle is slowly getting elongated, all right? And as you feel, things are starting to relax. And by the way, you should be like leaning back and just let your neck, relax totally while you're doing this, okay? So you just sit like this for about 20 minutes. And during the treatment section, as your neck and shoulders start to relax more, you can add a little bit more pressure to have a little bit more stretch. So whatever's comfortable for you, all right? And once you have it set, there's a little valve here. We can push that little ball in, close up that valve, just like that. And then just feel that pressure being released, okay? No more weight on your neck. It just feels nice. Now after 20 minutes, okay, you just release the air. Simple. We just turn this valve and all the air comes out. And we take it off. Oh, I'm telling you, this feels so good. You feel you got full range of movement. No more, cracking in your neck when you're turning because everything moves nice. So this is what you do. If you have neck problems, neck pain, neck stiffness, tension in your shoulder, if you have recurrent headaches, migraine headache, tension headaches, if you have trouble sleeping, okay, then you got to use two things together, right? You got to use the pain therapy system first to relax the muscle, to relieve the pain. After 20 minutes with the pain therapy system, then put the neck comforter on right away, right after the pain therapy session, right? Then that stretch and improve the posture of your neck. So the two treatments combined will give you the best result. Once you try it, you understand how good you can feel. If you have low back pain, if you have herniated disc or protruded disc, or if you have numbness or pain in your hip and in your legs, what we call sciatica, you're going to love using the pain therapy system because it's very effective for treating those conditions. Now, first thing you do, let me turn around here, is you put the two big pads on both sides of your back, like this, okay? And then you just turn it on. Let me turn it on first. And then you just turn it up to a point where you actually feel the muscle is contracting and relaxing. And you're going to feel many different types of stimulation, okay? With our device, every few seconds, you actually get a different type of treatment. And that's why it's very effective. Your body never get used to it because it's always constantly changing, all right? So you're going to feel a deep, soothing massage deep inside your back, and that feels really nice. Now, ideally, okay, you should be sitting down, relaxing while you're getting back treatment. But however, if you must use it while you're standing or walking, you can. This is a portable device, runs on 2 little batteries, so you can take it anywhere, okay? So, but in an ideal situation, okay, you should be sitting down. So let me sit down and show you. Now, you can use this while sitting, driving your car, or while you're working in front of your computer, or just while you're watching television, all right? So that's the best. Let your back relax, put your feet flat on the ground, don't cross your legs, and just feel that deep, soothing relaxation. And you can feel the circulation actually improving and going on as you gain the treatment. And do it for at least 20 minutes, but if you have more time, do it longer. Frequency-wise, 3 to 5 times a day. until you feel you reach a maximum, recovery. And then after that, you can just, use it as you need. Now, if you do have hip pain or numbness running down your leg, I'm going to show you how to treat that, okay? That's relating to a pinched nerve or a herniated disc. So we're going to treat that more frequently and in the right position. So let me stand up. Now, let me turn the machine off. So to treat sciatica, okay, we need one pad right in the buttock, all right? Because this is where what we call the piriformis muscle is, and that big nerve, that big sciatic nerve, exits from the hip and runs down your leg. So I'm going to take one pad. So if you have pain or numbness in this side of the hip or your legs, then I'm going to keep one pad on the lower back on the same side. Then I put the other pad right over the sciatic nerve, which is right in the buttock area, okay? For the man, that's where you put your wallet, okay? Right there, right? So you want to stimulate that. So you just, again, sitting down, turn it on, and turn on until you feel a nice, deep, and also fairly strong stimulation. And you can actually feel the circulation running down your leg. Now, for those of you who have diabetes, if you have diabetic neuropathy, meaning you get numbness, you get pain down your leg, or sometimes you just feel this what we call restless leg syndrome. You in the middle of the night, you just can't sleep because all this weird sensation in your legs and it's very uncomfortable. Or you can use it in the same area, lower back and the hip area. This is very, very powerful, very effective treatment in these two locations. Make sure you do this two area. Yeah. Now, if your pain and numbness goes all the way down, your leg, if after treating this area alone doesn't get rid of that, in addition to doing this, you can, add the following treatment. So after 20 minutes, this area, if you're still feeling some discomfort, I leave the pad on the buttock, and I take the second pad, and I put it to wherever my problem is. So if my pain and numbness goes to the back of my knees, that's where I'll put the pad. If your pain and numbness go down to your ankle, then I put it right down, to the bottom of the calf. Because what I'm trying to do, I'm trying to stimulate and restore normal circulation. So if you have any circulation problem in your legs, from a disc problem, from tight hip muscles, from diabetic neuropathy, or if you had a stroke, you can do exactly the same treatment because we are going to stimulate the nerve and muscle to restore their function the best we can, okay? So use this regularly and you'll see a big difference. All right. Now I want to show you another optional item that we offer for people with chronic back pain. If you're the type of person that gets back pain all the time, okay, it happens when you're out walking, happens when you're driving, happens when you're flying, okay, happens when you're doing anything, then this is a very good item for you. It's my all-day back pain relief belt, okay. It's designed to use with your pain therapy system, and it's very simple. You just plug it in, you turn it on. It's got built-in electrodes, okay? So you get stimulation and it stays on you. It gives you some support, okay? And it gives you stimulation anytime you need. So you just set it and you can set the timer, 10, 20 or 40 minutes, put it in your pocket. You can go about doing everyday things without worrying that your back may be giving you trouble, okay? And then, after the treatment, you can turn it off, and then every once in a while, say if you're out doing gardening, okay, you're working for an hour, then all of a sudden, oh, my back's getting sore, tired. Well, before it gets really bad and go into spasm and give you a lot of pain, all you do is turn the machine on, okay? You can keep on doing what you're doing, and the pain will start to go because the muscle get relaxed, the circulation comes back, and then everything's fine. Or if you're driving long trip, again, have this on every once in a while, hit that on button, and then you're going to be nice, nice and relaxed, and keeps you out of pain, okay? So if you have chronic back pain, you should look into this all-day back pain relief belt because it can give you relief anytime you need. Now, I'm just going to open it up and let you see the inside, okay? Now, you may have different versions out there, but they all function basically the same way. This belt has built-in electrodes, okay? So it's got these electrodes and really, really good electrodes, and they are reusable. You can reuse them, over 100 times, and you need to replace them, you can always just, go on our website and find out how you can get additional ones. And it's very easy. Now, when you don't want to use electrodes, you can just put the cover on. It'll protect that, and you can wear this thing as a regular support belt as well. So that's an additional benefit of this belt. You can use it as a regular belt. You flip the cover over, okay, and then you plug the wire in, and then now you have pain therapy system for all-day therapy. So it's a beautiful device. You should try it. Now, if you have back pain, if you have a disc problem, like a herniated disc or protruded disc, or if you have a nerve problem, a sciatic nerve problem that's causing pain in your hip, in your legs, also numbness, problem with sensation and circulation in your legs, then you should be using the pain therapy together with the decompression belt. All right, you can read up more on our website. Now, the decompression belt helps to support your back, but more importantly, it also has a second function. It actually helps to traction your back. It helps to stretch your back, to stretch the muscles deep inside, so it gets its normal length, and it takes pressure off your disc. Allow the disc to absorb moisture so the disc can expand because it creates this vacuum inside your disc. And because of that, your nerve will not be pinched, and then you have less pain. Okay, so this is very important. So the pain therapy, I recommend you use it first for about 20 to 30 minutes to relax the muscle, to reduce the pain. And then right afterwards, you put the decompression belt on to help stretch your back, to help to restore normal back muscle and dysfunction. All right. Now this is very easy to use. You just basically, it comes with a hand pump. We're just going to put together the air valves. So I screw the air valves together. And then I'm going to turn around here. I'll show you what happens. When I pump this up, okay, the belt actually rises against my back. You see? Every time I pump, it gets higher and higher. And what it does, it actually lifts my upper body weight off my lower back, taking the pressure off. Also, because it offers a very strong support, it acts like a barrel. It helps to support the core and improve my posture. You actually get lifted up a little bit and you stand taller. But more importantly, with time, 20, 30 minutes, okay, the inside your back starts to do this. It starts to expand vertically. All the pressure coming off your back, it just feels so good. And if you have circulation problem in your legs, or if you have a chronic back problem, or your back always feels tense, this is something you should be using together with your pain therapy system. Try it, and you're going to see incredible results. Now let me show you a series of exercises for your back, mostly to improve your movement, flexibility, and some strengthening as well. Okay? Most important is to have full movement. So the simple thing to do is just rotate your spine this way. Now lead with your head. So I'm turning my head first to look behind me. And notice my arms. They're very nice and loose to help me swing loosely. And my back, I keep it loose so it can be stretched. So I suggest doing about 20 of them. Okay, and I also suggest you do them first thing in the morning and again before going to bed. This is a very simple exercise you can do at work as well. When you sit in front of the computer for a long period of time, just get up every once in a while to just move and lubricate the back. Okay, now, next one. I'm going to raise my hand. And I'm going to hold my hand together. And take a look at my waist here. I'm stretching the whole side of my body. And I do the other side. You should be feeling stretching on the side of your body. Okay, and again, repeat about 10 times, all right? Now, next one, I'll put my hands together and just put that over my head, and I'm going to extend my back, okay? I make my spine very straight and going up, and then I'm going to rotate. Okay. That should give you some idea. Again, you do about 10 each time. Now, next one I'm going to do, I'm going to be reaching my toes. Okay, so let me bend forward. What I'm going to do is reach the opposite toe. So just go like that. Again, I lead with my head. So I look up to the ceiling as I reach down. So I get my whole spine to rotate. And I can adjust the stretching by adjusting the width of my stand. Okay? Look up to the ceiling and bring your hand way back. Good. Now, another thing I do, just going to be reaching to the ground. So I reach forward. I reach right below me and then behind me. Okay, so 1, 2, 3. 1, 2, 3. 1, 2, 3. Now, if you can't go all the way, don't worry, okay? But you should be keeping your legs fairly straight. So 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay? Now next thing, I will reach to the side. So 1, 2, 3. And the other side. 1, 2, 3. So let me turn so you can see better. Okay? So 1, 2, 3. 1, 2, 3. Okay? Good. Now when you get up, you should bend your knees and then get up this way. Then your head won't feel lightheaded. Let me show you. So anytime you're bending down, don't get up right away. Bend your knee forward and then get up this way. That way you won't get lightheaded. All right. Now other stretches have to be done on the floor. So let me go down to the floor and show you. A simple one is we cross our legs this way. Then using the arm as an anchor, I'm going to be pushing my arm this way. So I'm going to push against my leg. And the other hand, I gently push. And the idea here is to rotate your lower back. So I can feel the stretching going on in my lower back right now. See? Ah, that feels good. Hold for a few seconds, release. Do the other side. So cross the leg first, cross the arm, anchor against the leg, push with this hand, and feel the stretch. Let the back go loose, and just feel the stretching. Feels good, and release. So side to side, stretching, release. Stretching, release. Okay? Again, you can repeat 10 times on each side. Now, I'm going to turn here, show you another stretch. Now this one, I want you to pull your knee towards the opposite shoulder. So pull the right knee to the left shoulder. So using my left hand, I'm going to pull my knee up and then across. And notice I'm keeping my shoulders flat on the ground. So my shoulder blades are touching. I'm just pulling my knee up and across. So pull up and across. Keep the shoulder blades down and feel the stretching, a light stretch in the hip and lower back. Okay? This you can do in bed. Okay? It's just a very gentle stretch just to get you going in the morning. Good. Now next stretch, I'm going to bring both knees to my chest. I'm going to just gently pump it up so that I can lift the base of my back off the ground. See? Just like that. So pull it up towards your chest. Notice my head and my shoulders stays on the ground. If I do this, I'd be straining my neck, and that's not good. So keep your head down and just pull 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so feel a nice stretch in the base here. Okay, now while you're in this position, you can do some sit-ups to strengthen your abs and your back muscle. Now, if you have back problems, you should do what I call rocking chair sit-ups, because that will not put any strain on your neck and will not put any strain on your lower back. So what you do is keep your back curved like the bottom of a rocking chair, and then rock yourself up like this. Okay, so the first step, let me explain. You bring your knee to your chest first, and then you rock up. Okay, so knee to chest first, and then rock up, just like that. See? So 1, 2, 3, 4, 5. Okay? So that's a common way. Now, if you're not strong enough to do it that way, then you can use your hand to give you some momentum to help you get up easier. So again, knee to chest first, but this time I'm going to use my hand to help me get up easier. Okay, so, and you see my back? I keep it nice and curved, just like the bottom of a rocking chair. Okay? Okay, so again, breathe out. So 1, 2, 3, 4, 5. Okay, so that's good for strengthening your abs and your lower back. Now, I'm going to go show you the next stretch. Next one, you have to lie face down. Now, for this stretch, we want to extend the back slightly. So if you have back pain, and if you're doing this one, if it does cause you more back pain, then don't do it, or do less. Okay, you have to kind of feel it, see if this one is good for you or not. So you can do it very gently. Just go up on your elbow, okay, and slightly and slowly lift your head up while extending your spine. And you should feel the lower back being stretched. Okay, once you feel that release, you can now go on your hand and just gently push up. Now, extend the back. And you can just gently rock it to loosen up further. And tilt your head back and just relax. Feel the back being relaxed and being stretched. And just hold it for about 10 seconds. That's all you need. And then just relax. And just repeat that 2 or 3 times, and that should be adequate. All right. Now, for the next exercise, okay, this one's a little bit more difficult. This one's specifically to stretch the, what we call the gluteus and piriformis muscle of the hip. This one's very important for anyone who gets numbness or pain in the legs, or for chronic back problem, okay, because we're going to stretch the back muscle as well as the hip muscle. Okay, so get into this position, and the leg you want to stretch goes underneath you. Okay, so I bend the knee on my left hip, that's what I want to stretch. I put underneath me, and then I'm going to bring my chest straight down. Now, I'm going to keep the opposite shoulder, this time it's my left shoulder, up, and my right shoulder down. So I can feel the pressure and the stretch on my left hip. That's a really good and strong stretch. Okay, just hold that position for 10 seconds. And then switch side. So this time, I'm going to stretch my right hip and lower back. So I bring my right leg underneath me. My contact surface is on the outside of my leg. So it goes straight down. And then I put the opposite shoulder down towards the floor while keeping the shoulder on the same side up. So you can really feel it. Okay. Now let me just change position so you can see it better from a different angle. So if I want to stretch my right hip, I would bend my right leg and put it underneath me. Okay? I go straight down. I put the opposite shoulder, which is my left shoulder, down while holding the right one up. And feel the stretch in this whole buttock, hip, and back area. Okay? To stretch the left side, I bring the left leg underneath me. I bring my chest down. And I bring the opposite shoulder, which is my right shoulder, down. That gives you a really nice stretch in this whole area here. Okay? So that's a really good stretch for anyone with hip pain, sciatic nerve pain, and low back pain. Now, for the next exercise, very simple. We're going to reach and touch the opposite toe. So, just sitting down, keeping your leg fairly straight, and then just reach forward. Now, if you can't touch your toes, it's okay. Just go as far as you can. It's the motion, and eventually, you'll be able to reach further and further. The key is to do it every day, and then you'll see better improvement over time. Okay, just like that. And then another simple stretch, just sit like that, leg in a V shape. Just hold your leg with your hand, use that as leverage, and just gently pull. So you feel it stretching. Okay, just pull your chest towards the ground. Just like that. Okay, again, those all help with different angles and different muscle groups of your back. Another one you can do is just bring your feet together, hold your feet, and just gently, okay, relax the adductor or the inner hip muscles. The goal here is to stretch and loosen up all the muscle around your hip and your lower back, because if you have good movement, your joints will move better, your muscle will stay more loose, and that's how you stay healthy. Now, one other one you can do is stretch the hip muscle. Is bring the knee like this and bring it towards you. See? Just bend the hip and pull it towards you. Like that. Turn over, do the other side. See? Just like that. Okay, so those are some of the basic stretching exercises for your back. And if you do them regularly, it's going to help you a lot. I do suggest that you use my decompression belt, my muscle therapy system, and some of the other supplementation that we have to help you regain your health and to stay healthy. Good luck with your health and best wishes to you. Now, if treating the abdominal area does not get rid of all your menstrual cramps, you need to also treat the lower back area. So put one pad on each side of your lower back. You can just go to treatment of low back pain section and DVD. But basically, one pad here, one pad on this side. And the reason we want to stimulate the back is the nerve that supplies the back muscle also have connection to the nerve that stimulates the uterus. So by stimulating the back muscle, I can help to normalize the nerve and muscle function in both the back and in the uterus area. Okay, so you can do that in addition for your menstrual cramps, and you'll find really good results. Now, if you have hip pain from osteoarthritis or other issues in the hip, like bursitis, okay, you can use a muscle therapy system to help you. Now, if you have a hip replacement already, or if you got metal implant, you can still use this, and it'll help you tremendously, because after surgery, you can have a lot of scarring in the area, and the stimulation will help to loosen up the scars and the muscle around that joint. All right. So after your surgery, after everything's healed, you can definitely use this, and you should be using it. And if you do have metal implant, And when you put the stimulation on, if you do feel little pins and needle, you simply move the pads a little bit, to the side, and that should be okay then. All right, so use the large flex tone pads. And what we want to do is we want to surround the hip, right? So if your pain is right in the hip joint, so we're going to put 2 pads around the hip. Or if you have the luxury of having 4 the large pads, you can do all 4 at the same time. So we want 1 above, 1 below. We're going to stimulate that for about 20 minutes, okay? And it doesn't matter which mode you use, but you do want to turn up to a point where you get some, strong stimulation and the muscles moving. Okay, so you feel nice contraction, nice relaxation, relaxing the area, relieving the pain and the inflammation. Now after 20 minutes, we want to switch the pads to different location. Now this time, I want you to put 1 pad right in the buttock area. This is where the nerve is, where the piriformis is, okay? So we're going to put that right on the buttock, where you put your wallet for the guys out there, okay, right there. And then the second pad, I'll just use this to show you. You want to put right on the groin area, all right? So just 1 pad right in the groin line, like this, all right? And again, do that for at least 20 minutes, all right? So basically, you're doing what we call surround the dragon. You're surrounding that painful joint. So I'm just going to repeat myself here. So to begin with, 1 pad above and 1 pad below, right there. Do that for 20 minutes. After that, 1 pad on the buttock, another pad on the groin line for another 20 minutes for hip pain. All right, good. Now, if you have groin pain, okay, like a lot of athletes out there have groin pain. They pull the groin muscle, and hockey players, other people who push off a lot, or they happen to hit the toe playing soccer, they can pull that groin muscle. So what you do is you put 1 pad around the groin line, and the other one just above it or just below it. And I would do both, all right, to help to relax the muscle and to stimulate the body's own ability to heal itself. So that's for anybody with groin muscle pain. You should be doing this treatment lying down on your back with your hips slightly flexed, okay? Put a couple pillows under your knee so that muscle can be relaxed while you're giving treatment, all right? Same thing with hip, okay? When you're treating your hip, you should be lying your back or sitting, and then put a couple, if you're lying down, put a couple pillows under your knee so the hip is in a nice loose position. Let me show you a series of exercises for your hip-related problems. Now find yourself a good chair, okay, to support yourself, or anything that can support yourself, and just swing your hips back and forth like a pendulum, okay? Don't need any force, just gently swing that hip. You just want that joint to go back and forth. Again, motion is lotion. You want to lubricate that hip joint. So this is very good for anybody with arthritic changes in the hip joint, or if you get tight muscle in your hip joint, that will help to loosen them too. So do this as often as you can throughout the day, and after a few months, you'll see a big difference with your joint pain. Now, I'm going to show you some stretching as well. So again, find yourself a good chair to support with. Stand with the bad leg towards the chair. Put the bad leg behind you, and support the weight with your hand and go down gently. Then you should feel the stretching on the side of your hip, just like that. Okay, now to stretch the groin muscles, I point my toes forward, front, okay, and back foot, and I just go down. Just go straight down and just a little bit forward, keeping my back straight or slightly extended, and just leaning forward, and you should feel the pulling in the front. Now if you want more stretch, you just have a longer stride, just like that, okay? And to stretch the adductors, I turn my foot sideways, and doing the same motion, I just go down slowly, supporting the weight with your hand, so you can control how much stretching you're going to have. So this, turn the foot out, I'm stretching the adductors. I turn my foot forward, again, like a fencer stand, all right? Just gently go down and slightly forward. So you feel some stretching here and in the front. Okay, so those are good stretching for your hip. Now, to work on any tight muscles that you might have inside the hip area, the gluteus muscle, the piriformis muscle, you just lie on your back, okay? Now this is a two-step process. First, you lift your hip up till it's making a straight line with your back. And then you push your feet away from your buttock. So my feet is going away from me. And that's the action. Now some of you may find it easier to be pushing against the wall or something that don't give. And if you do it right, you can feel the buttock muscle really tense. But the hamstring muscle at the back of the leg here, that stays nice and loose. If you just feel tension in the back of your leg, then that's not correct. You want to feel the tension here. This is the muscle you're working on. And the hamstring stay nice and loose. So push away from you, contract for 10 seconds, and relax. Okay? So lift up, push away. Push, 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 push for 10 seconds. Again, this is tense, this is loose. And relax. And repeat that 10 times. And then do that a couple times a day. That'll help you a lot. Now, if you have problems with your upper leg, okay, I'm going to show you how to put the pads and where to put the pads for each muscle group. So if you have a problem with the hamstring group, so you just put one pad on the lower portion of the hamstring, and then one just in the belly, okay, of the hamstring muscle, just like that, all right? And you just simply turn it on. Now, you want to make sure the muscle is nice and loose while you're treating it, all right? So you don't want to be tensing it up, okay? Just like that, you want to let it contract and relax so that it can go through its workout cycles, and then the blood will circulate better, the nerve will circulate better, and then the muscle will start to heal on itself. Now, if you have sciatic pain going down your legs, okay, this is one area you can use that. But the other area that's crucial is right here in the buttock area. So you want one pad here, and then the other pad, you know, in the location where you're having pain or numbness. So I'm going to talk more about sciatic pain in treatment of low back and sciatic section of the DVD. Now, if you have, let me turn it off, pain on this side here, what we call iliotibial band syndrome. This is what you do, all right? You put one pad on the side of the thigh, and the second pad, there's two locations, okay? One is you put it just in front of your hip here, and then another one just to the back of the hip. What the objective here is to basically relieve the pain, you know, where the tibial band is. That's one sheath that runs here. And the other objective is to normalize the tone of those muscles that's controlling that iliotibial band. So we're going to control the hip flexors and control the hip extensor muscle. So by putting it here, we're going to relax the hip flexors. By putting behind the hip, we're going to relax the hip extensors, so that if those muscles pull properly, then this iliotibial band will work better, and then you can have less pain. Now, if you have pain right where the iliotibial band, you know, connects to the knee area, then what you do is put one pad, you know, over that area and the other one in the middle of the iliotibial band. This is very important for those of you who do a lot of sports, especially running sports, sprinting sports, okay? Those areas can be troublesome. Okay, next area, if you have hurt your quadriceps, okay, that's the, you know, four muscles that make up the front of your thigh. So basically, again, whichever muscle you feel is giving you a problem, you just put the pads over it. And it's very simple. The key is make sure your legs nice and relaxed. So you probably should be just sitting down, you know, letting your legs hang loose, and then let the machine, you know, stimulate the nerve and muscle to restore normal motion and normal function back in those muscles. What the machine does, it basically relaxes the muscle. So if they're too tense, which is usually the case, it'll help to relax it. It also helps to tone the muscle, meaning if the muscle fibers are too loose, it helps to bring it back its normal tonicity, okay? So it can do both because it normalizes the nerve and muscle function. Now, the other thing it does, it helps to stimulate the nerve and blood circulation. And if the blood and nerve is circulating better, you're going to get better, better and faster pain relief, but more importantly, faster tissue repair. So we basically are trying to help the body to heal itself faster, and that's the key here. Now, some of you may be getting what we call patellofemoral joint syndrome, meaning you get pain behind the kneecap, okay? It's not the ligaments, it's actually behind the kneecap. And that can be caused by imbalances of the muscle that control, okay, your leg movement. So if that's the case, I would treat the knee. So go to the section where, I teach you how to treat knees. But I would also treat the muscle of the quadricep, especially this muscle here, what we call the vastus medialis muscle. So we put one pad there, okay, as one, as part of the treatment, and then we stimulate, because we want to make sure the tone of this group and this group are normal, okay? If we do that, then the kneecap will stay in better alignment because you're pulling on it evenly. It's like different cables. If one cable is too tight, then the alignment is going to be off. But if both cables are equally, have equal tension, then the kneecap's going to track better, within the knee joint. So that's going to make it work better. So for the vastus medialis, and then the other group on the outside. So in the fancy name for this muscle group is a vastus lateralis. Okay. So basically, this is what we do. All right. Time-wise, usually I keep the treatment around 20-30 minutes because that's the amount of time you need to help to see and measure a big difference in improvement. And repetition, anything from 3 to 5 times a day or as you need it is fine. Again, don't worry about overusing. Now, another muscle group that often causes people problem is the adductor group. Okay, the muscle inside your thigh. So this one, okay, you basically put it close to the groin line, okay, right here, that's close to the attachment, is where they usually have the problem. And the other one just a little bit further down. Make sure the pads are not touching. If anytime the pads are touching, the machine, you're not going to feel stimulation because the electrical pulse will go through the pads instead of your body. Okay, again, just turn up to a point where you actually get contraction. Just as a reminder, always let that muscle that you're treating be nice and relaxed. Let the machine do the work. Don't fight it, okay? Just let it do its own work, and then it's going to heal much better, just like that. Okay, and that's it, okay? Best wish to your injuries, and hope you heal very fast. Now, the pain therapy device can be used to treat your face for different problems. If you have what we call TMJ, temporomandibular joint problem, where you're pain here, when you open your mouth, or you have a hard time opening your mouth, we can use that to treat that joint pain. If you have what we call facial paralysis, either due to a stroke or Bell's palsy, where there's a virus attack on the nerve and cause the face to become, paralytic without any known reason, we can use it. Or if you just want to use it for facial toning or to get rid of some of the fluid that's building up in your face, the reason is when we stimulate the face, we stimulate the nerve and the muscle underneath. Another condition you can use it for is the trigeminal neuralgia. Now, this one is very painful, okay? If you have that, understand. And that one, you're not going to see the response immediately. It will take some time. But for the other condition, you should see response fairly quickly. Now, to treat the face, only use the small pads. The big pads are too powerful, okay? Use the small pads and wash any makeup or oil off your skin first because the pad have to make good conduction. And because the face is usually oily, the pads will not stick on by themselves, so you're going to have to hold it on. Now, I suggest you use mode 3. That's a very gentle mode. Okay, we turn the machine on first, and we go to mode C. Okay, A, B, C. All right, that's a nice gentle one. And what you do is one pad. Okay, so in front of the ear, that's where the nerve exits from the face or the skull. Okay, so if you're pain or paralysis at the top, you leave this pad here. You put the second one here. And then you don't have to do it for long, 10, 15 seconds for facial toning, and sometimes even for pain, that's all you need. And then here in the middle, and then just below the jawline, you can feel a little groove where the nerve exits, just right there. All right? Those are the 3 major areas you can use on your face, okay, for facial toning, for relieving pain, and actually even for toothache. So for any toothache at the bottom of your mouth, using the lower nerve. On the upper jaw, okay, we do it this way. Very simple. And the length of treatment, you can decide that for yourself. Some of you need a very quick treatment and you get good results. Some of you, if you have Bell's palsy, okay, or something more serious like the trigeminal neuralgia, you have to do it for a lot longer. But don't worry, you can use this device for as long as you like. There's no chemicals, there's no drugs, and no side effects. So you can use it safely for as long as you like, as frequently as you like. Best wishes to you. Now, if you have what we call carpal tunnel syndrome, where you're having numbness in your hands, okay, especially the thumb and index finger, and you're losing control, the coordination and the strength in your hand, that means you have a pinched nerve going down to your hand. So that problem can be coming from the wrist, but I can tell you from my practice, that a lot of people who's been diagnosed with carpal tunnel syndrome do not just have problem with the wrist. In fact, the majority of them have problem with the neck. So if you have any problem with your hand, like numbness, loss of power, loss of coordination and strength, make sure you treat your neck. That's the most important area, more important than your wrist, okay? Now, you could treat your wrist, but I've found many people in my practice, many of my patients, I just look after the neck and we restore the function there, and the hand and wrist works fine after that, okay? So, to treat the wrist, if you have pain from arthritis or chronic sprain, or if you have fractured your wrist from a fall, you get a lot of scarring and restriction movement, then this treatment is very good. So, to treat the wrist, okay, we just use the 2 large pads. Now, the important thing here to remember is because the pads are pretty big, we don't want the pads to be touching against each other. If the pads make contact against each other, then the current will go, between the pads instead of going through your body. So, it will not work in that sense. So make sure the pads are not touching each other. Now, anytime you're treating any area, make sure that body part is nice and relaxed, okay? So that you're not, you don't have to flex your muscle. Let it relax, put it in a neutral position. So I always use a cushion here and just stimulate it. Now go slow here because there is a nerve here called the median nerve that runs through your wrist, okay, between the 2 tendons, and it's very sensitive. So you're gonna feel stimulation going right down into your fingers. Okay, I just go slow. There it is, okay? So you're gonna feel the muscle contracting and feel the sensation, the circulation going to your fingers. And it's a very nice feeling as long as you go slowly with the device in turning up the intensity. Just like that, okay? So 1 pad on each side, and you can see my hand, is contracting because the muscles is working and the nerve is being stimulated. And that's what you do, okay? 20 minutes at a time, 3-4 times a day until you feel better. Now, if you have arthritis in your fingers, okay, any of your fingers, from osteoarthritis, if you have rheumatoid arthritis, that's very nasty, all swollen up and loss of mobility, okay? If you don't use this, that's great, because I've seen many patients who use this and they've been able to reduce the anti-inflammatory and the painkillers they have to take, which is very hard on your body. So you can use this to reduce your meds, or some of my patients actually don't need meds anymore. But before you change any of your medication intake, consult your own physician, please. All right? So to treat any of the fingers, you just sandwich. Very simple. Just sandwich your joints with the pads, okay? If you play ball, sports, and you sprain your fingers, just do this all day long. That's the best way to stimulate the circulation and the self-healing, okay? Just like that, all right? By doing this, I'm gonna reduce the inflammation, reduce the pain. Now, if you have arthritis anywhere in your body, go to our website too, because we have a lot of good supplements that are very good for, joint inflammation or cartilage problems. Just like that, all right? Best wishes to you. If you have elbow pain right here, then you need to stretch out this group of extensor muscles. To do that, just grab your palm, pull your wrist towards you while you're straightening out the elbow, just like this. Okay, you can hold it for a few seconds and repeat it about 10 times, just like that. All right. Now, if you have pain on the inside of your elbow, right here, then you need to stretch out the flexor group of muscle. And to do that, you have your palm face away from you. And again, I'm pulling the wrist, so I'm pulling the hand towards me while I'm straightening out the elbow. I can hold it for a few seconds to give it some more stretching and repeat about 10 times or whenever you feel you need to. All right. This is important for anyone who do a lot of computer work. If you do a lot of heavy labor work with your hand or gripping action, then those muscles can tense up. Or if you play certain racket sports, again, they can give you trouble. So do those exercises regularly can help to maintain the length of those muscles so it doesn't pull on this, so the attachment of the tendon doesn't pull on the bone, so you stop getting those problems coming back. Now, if you have a wrist problem, okay, if you had a fracture before, you got some arthritis in there, and you lack motion in that wrist, the best thing to do is to flap that wrist loosely, okay, just like that. In fact, let the arm down all the way, okay, and just flap it whenever you have a chance, okay. Just do that as often as you can throughout the day, and that can help to restore the motion in that wrist joint. Now, if you have trouble turning your forearm, okay, there's two bones here and they cross over each other, and sometime after a fracture with the casting effect, you get a lot of scar tissue, so you cannot turn your hand. Well, don't give up. Just repeat, okay? Lots of repetition. Just turn and give it a little snap at the end, like try to use some momentum to get motion. So again, let the arm go loose completely. Just turn, 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 turn. So whichever direction you have restriction, and usually it's going out, then I would do that repeatedly throughout the day. And that will help you restore the motion that you have lost. Now, for any finger joints that you may have arthritis or other problem that cause loss of movement, then throughout the day, again, you can just slowly traction those joints, just like that. So whichever joint gives you trouble, just pull on it and move it passively, just like that. Okay, and take it to the range of motion and just gently stretch it, each joint just like that. Okay, so again, any joint you have problem, just move it. There's an old saying, motion is lotion. So when you move a joint that's stiff, you can help to lubricate the joint so that you can restore some of the motion you have lost and also to maintain what you have. I mean, maintaining good range of motion throughout the body is very important to stay active and to stay healthy. Now, if you have pain in your elbow right here, okay, what we call lateral epicondylitis, okay, you're probably doing some heavy work with gripping, or you actually play some sports, or you could have a circulatory problem or a pinched nerve problem from your neck that supply this muscle group. Now, to treat this, okay, what we're going to do is we use the large flex tone pads, and we're going to place one right over the painful area, and then the second one, we're going to just place it below. Our goal here is to relax what we call the extensor muscle of the forearm, and to reduce the pain here, and to reduce the inflammation, to stimulate the circulation overall, to allow the body to heal itself. All right. So if I stimulate my muscle this way, it's going to speed up recovery. Now, before we do that, anytime you stimulate any body parts, that body part should be fully relaxed in a neutral position. You don't want to be holding your arm up while you stimulate, because now you're fighting against the machine, and that's not good. So get a cushion, okay, make sure your arm's nice and relaxed. We just turn it on. All right, and doesn't matter which mode you use, but you want to have it high enough, the intensity high enough that you actually get some muscle contraction and relaxation. All right, so I also suggest you trying to rest the arm and not to do the repetitive motion as much, so they have a chance to heal properly. And also, you should try treating your neck, if this is an ongoing problem that you had for years and years and not a recent injury from just doing something, external, that's too straining for your body, you definitely should be treating your neck. You just go to the section on DVD where I teach you how to treat neck and headache, and you'll learn how to treat the neck, because I've seen in my practice many times people who get pain here and they don't even do hard work, okay? They get numbness and weird sensation in the arm, or they get what we call carpal tunnel syndrome, where their hands go numb and they lose control. It all comes from the neck. So do not ignore the neck. This is where the blood and nerve starts, and it circulates down your arm. And you need the blood and the nerve to circulate 100% in order for your body to function right, so that it can repair itself. So if you don't treat here, then it's very hard to get 100% result by treating the painful area alone. Okay, so just to remind you of that. Now, you feel pain on the other side of the elbow, right here. Okay, actually here we call it, tennis elbow, whether you play tennis or not. And on this side we call it golfer's elbow. Okay, again, whether you play golf or not. So here we do the same thing, except now we put the pads over this painful part of the area, and on this part of the muscle group, the flexor group. And this is also very good for anybody who get that numbness and tingling down their arm into the fingers, the carpal tunnel syndrome group. So we just turn that on. And here, just turn up slowly, because there is a nerve that runs through here and here. So it's quite a sensitive area. So just go slow. In fact, anytime you're using the machine, turn up slowly, because a lot of you might misjudge my machine by its size. You go, wow, so small. I'm not going to worry about it having too much power. But I can tell you, this is one of the most effective and most powerful device on the market today anywhere, all right? So just like that, okay, make sure your arms relax. Just let it do its work, okay? Let it relax the muscle, stimulate the circulation, and then your body will heal on its own. Now, if you have shoulder pain from tendonitis, bursitis, or arthritis, you should be doing this treatment. Use the large flex tone pads in 2 areas to start with. We're going to put one in front, and then one in the back of the shoulder, all right? And we just turn it on. And it doesn't really matter which mode you use. I personally like mode A and B the best for this area. And the key here is you want the arm to be fully relaxed. In fact, when you're treating any body parts, you should be fully relaxed in a neutral position. You don't want to fight against the machine, all right? You want it to be nice and relaxed, so the pain therapy stimulation can help to work the knots out, to reduce the inflammation, to stimulate circulation, okay? You can only do that if you're nice and relaxed. So I usually like to get a cushion and rest my arm like this, so that the shoulder can be totally relaxed when I'm doing this treatment. Now, you see the muscle moving, and that feels really nice, okay? It feels like the knot inside is getting worked out. If any pain inside, it's gonna help to, reduce the pain, improve the circulation, reduce the inflammation, and more importantly, help to break up any scar tissue that you may have developed. So some of you may have trouble, raising your arm, like what we call frozen shoulder problems. Then you gotta do this to break up the scar tissue. Now, if you have a chronic problem in your shoulder, elbow, wrist, hand, like numbness and loss of sensation in your arm, and using the stimulation in those areas alone may not be enough. You also need to stimulate and treat your neck with my pain therapy system, because if there's problem in your neck, you may not have neck pain, but it can cause entrapment or pinching of the nerve that starts from your neck, that runs through your shoulder and through your arm to your fingers. So in order for you to get the best results for any chronic problem, I suggest you also treat your neck, which I'll show you in the next segment, okay? And also the local area where you're having pain. Now, and let me continue with the rotator cuff area here, okay? So after 20 minutes with the pads in front and behind, I usually like to stimulate another set of points. Now, a lot of the points I'm showing you are related to the acupressure or acupuncture points, which I learned, from my studies. And by stimulating the nerve and the points, we're going to get really good results. Combined with the new technology we have, okay, inside our pain therapy system, and if you're using it now, okay, there's many, many different types of treatment programmed to this device. And because it's constantly changing, okay, our proprietary technology allow your body to get better faster because it will not adapt to it. And that's why, you get such great results even after 20 minutes of use, okay? Now, with any injury that are chronic or acute, do not be afraid to use it, frequently, okay? You can use this 3, 4, 5 times a day. Whenever you have a chance to sit down and relax, just do it, okay? Because that'll speed up your recovery. I know before my practice, people can only come to my practice, to see me maybe 3 times a week maximum. And they don't heal very fast because they're not getting enough treatment. Well, with this home therapy device that's portable, you can get as many treatment as you need and whenever you need it. And that's why, this is getting such incredible response with so many people with different problems. So do that and you'll get better faster. Now, here's a good exercise for your shoulders. If you have bursitis, tendinitis, arthritis in your shoulder joint, or if you have trouble lifting your arm up all the way, then you should try this exercise. It can help to just break up some of the scar tissues inside to increase the range of motion. So first thing you do is just hold your arm up as high as you can, okay? Make a fist and whip the arm down as fast as you can and then let it go completely loose so that the momentum brings the arm back up. So whip it down fast and let the momentum bring it back up. So like this. Now you don't have to stop at the top. I'm just stopping so you can see. You can do it continuously. Come down fast, let the momentum bring it back up. Now, do not use your muscle to lift it because you won't be able to, okay? It's the momentum that brings it up and then that breaks up some of the scar tissue. So let me show you again. So bring it down hard and fast and let it go completely loose and let it go around. Okay, so do about 10 times in one direction and repeat in the opposite direction. Again, I start with the arm up as high as I can. I'm going to bring it down hard, let it go loose, let the momentum carry around. So here we go. Okay, just like that. And you'll find it'll start to get more loose each day as you do this. All right, keep doing it until you get your full range of motion back. Now here's some other stretching exercises you can do for your shoulder. Okay, one is if you want to stretch the back of the shoulder, just bring your arm out, anchor with the other arm, and just pull. Okay, you should be feeling the stretching back here. Now once you feel the pull, you can rotate your body slightly to get additional stretch, just like that. Okay, now you can hold for 10 seconds, or you can just gently tug on it to get that stretching effect. All right, another stretch is just bring your arm up, bend at the elbow, and grab the elbow with the other hand and pull down till you feel the stretching happening in this area. Okay, and to get additional stretch, just bend this way. And then now you can feel it stretching all the way down to the side of your body as well. So that's a nice stretch. And then if you want additional stretching, just rotate it this way. Okay? Now some of you may have trouble turning your arm. So we want to increase the range of motion there. So to do that, bring your arm out, turn your palm up, and go back. And then when you come back in, turn your palm down, and go across. So, now bring it all the way back till you feel the stretching action in the shoulder and in part of the chest muscle. So, Palm up on the way back, palm down on the way back. Okay, so those are the basic stretching exercises you can do for your shoulder. I suggest you do each exercise about 10 repetitions each time, and just repeat it throughout the day, 2-3 times a day, or as you feel you need it. The key is to do it every day, because that way you can restore any movement that you have lost, and also maintain any good movement that you do have, and then you can stay healthy all the time. Now, you're going to love this treatment. If you suffer with foot pain from just standing too much, from being in your high heel shoes, if you love a foot massage, or if you suffer with pain from having plantar fasciitis, heel spur, if you have arthritis in your joints, okay, from gouty arthritis, which is very painful, rheumatoid arthritis, and degenerative, osteoarthritis, this will help you a lot, okay? This is my optional accessory, the foot relief massage pads. And when you use the foot massage pads, just use them alone. Do not use it with other regular pads. So just use the foot pads alone. Take your socks off, because the foot massage pads have to make direct contact with your skin. And oh, by the way, if you have circulatory problem, this is the best thing to stimulate the circulation in your lower limbs, all right? So if you have any circulation problem, do this on a daily basis and you'll feel much better. Okay, so basically, we just take the foot pads, we plug them in, okay? Doesn't matter which side. And take your socks off and sitting down. Now, these foot pads, they do not go in your shoes. They just go on the ground, okay? It's not designed to be put in your shoes. So you just put your feet on, and then you just turn it on, okay? Until, woohoo, that feels nice, okay? Until you actually feel the stimulation and the circulation rising up your legs, okay? And depending how high you turn it up, you can feel the stimulation go all the way up, and it's a wonderful sensation, okay? And you get a really nice massage in the bottom of your feet. So basically help to reduce inflammation, stimulate the nerve, so that if you have any numbness, it's going to help to restore the sensation. So this is very, very important for any of you who suffer with diabetes, okay? If you happen to have chronically sprained ankle or chronic swelling in your ankle or your calf, use this, especially if you're going to be sitting for any length of time. Just put this on the floor when you're sitting in the office, or when you're riding on the plane, or even in the car for a long period of time, okay? This only uses batteries, so you can take it anywhere. So use that continuously. If you have pain in this toe, this is great, okay? That joint, for a lot of you ladies, you get arthritis in this toe because you wear your high heels and and your toes all get all pushed in like that. If you're like me, I play a lot of sports. I abuse my feet all the time, like I bang things up, and I get so sore from standing all day, doing work at standing in trade shows and walking for long hours. So I use this at the end of the day. It just relaxes you, okay? Not only that, if you take a close look, these pads, let's turn off, they have those special knobs here. They're designed to stimulate the reflex points to help to balance the nerve energy in your body, okay? In Chinese medicine, we believe reflexology or foot stimulation can help restore balance in your body, okay? So, I would suggest that you use this on a regular basis to relax you, okay? And to relieve any pain, to restore circulation, reduce swelling. It's just a wonderful, optional accessory to use together with my pain therapy system. Enjoy it. Now the foot pads, if you have these, okay, those do not need to be replaced. They will last you a lifetime. So they're fantastic. And if you do find them don't conduct as well as you like because you got very thick skin on the sole of your feet, or if you happen to have some kind of neuropathy from diabetes or severely pinched nerve in your back, say your feet's all numb and you don't feel the sensation, one thing you can do to improve the conduction is you can actually put a little water either on the bottom of your feet or on the foot pads themselves, and that'll help to make the conduction better, okay? So that's another tip for you. So take care of your electrodes, and it will take care of you. Now, if you have pain in your ankle from a sprain, old fractures, or if you have arthritis in your ankle, or if you have swelling in your ankles, do this treatment. Now, take the big pads and then put one on each side of your ankle. Now, one thing you have to be aware of is that make sure the pads are not touching each other. See, if the pads are touching each other, then the current will go through the pads and not through your body. So make sure the pads are not touching each other. Very important. So let me space them apart even more so you have a really good idea that they are not touching each other. All right? Okay. So once you got them on, and then you just turn it on. Okay? And just like that. And again, we want to turn to a point where we're actually feeling a little bit of movement in the muscle around the area, because that will help you to get your best results. Now, if you happen to get swelling in your ankle from sitting on a plane or sitting too long, period. If you have diabetic neuropathy, you can use this while you're sitting on the plane or when you're traveling anywhere, or even when you're sitting in the office for long hours, okay? If you have a recently sprained ankle, then keep this on all day long, okay? You don't have to worry about overusing it. Just, stimulate it and do the exercise. I taught you, I'm teaching you in the DVD, okay? If you do that, you're gonna see much better recovery. Just use it as often as long as you can. If you have a recently sprained ankle, it'll help to reduce the inflammation, you improve the circulation, and speed up the recovery of the overstretched ligament, and relax the muscle around the area, so you get much faster healing than if you don't do it. All right. Now, if you have a recently sprained ankle and it's really bad, it's all swollen up, you can't put any weight on it, you can't walk, best thing you do is to leave the pads on and keep it stimulating all day long. Okay. The more you do it, the better it is, and also do the exercises that I show you in the video. If you have chronically swollen ankle from poor circulation, or if you have diabetic neuropathy, then again, use it often. Use it while you're traveling, sitting on that plane, sitting in the office, even sitting, watching TV at home. Just use it often and regularly, and you'll see the best results. Now, if you have pain in your ankle from arthritis, or if you happen to sprain your ankle badly, then you should be doing the following exercises, okay? What I want you to do is just move your ankle back and forth in its full range of motion as often as you can. So just like this, okay? Watch. So just moving, point your toes down, point your toes up. Toes down, toes up. Toes down, toes up. Just whenever you have a chance, just keep doing that. Pump your ankles, okay? Just pumping it will help it heal itself. Now, you also need to set the ankle back into its place. So what you do is find yourself a step, okay? Hold on to something, and then just step on the edge of the step and put some weight on your legs, okay, to weigh down the ankle. So to push the ankle deep back into the socket, just like that. And also help to stretch out your calf muscle, okay? So just like that. And to strengthen the ankle, then what I suggest, you just go up and slowly sink down. Go up and slowly sink down. And just repeat that every once in a while. So that will help you recover much faster than if you don't do these exercises. Good. Now, if you have knee pain from arthritis, osteoarthritis, rheumatoid arthritis, gouty arthritis, or sports injury, okay, like a ligamentous tear, menisci tear, if the tear is minor, okay, you can actually use my machine to help treat yourself for excellent results. And it's very easy to use. All you do is use the large pads here, the large flexion pads, and put one pad on each side of your knee. Just like that. Okay, and just turn it on until you feel a nice stimulation. All right. Now, Besides using the stimulation, you should also be doing the passive exercise I'll be showing you, okay, as part of this DVD series. And you should also take a supplement, especially if you have joint cartilage, degeneration or damage. You should take some joint supplements, and you can always go on our website to find out which supplement is best for that. So I suggest you stimulate the area at least 20 minutes at a time, 3, 4, 5 times a day, or whenever you can. In fact, if you happen to have a sit-down type of job, you can actually have this on all the time. The more you stimulate, the faster it's going to get better. All right? So basically, this is the main treatment on both sides of the knee, and that's what you do. Now, some of you may have some pain behind the kneecap, the patella. Then what I suggest you do, you just put the pad above the kneecap, okay? And then the second one, you can put it anywhere you like. But we want to stimulate this area because there's a small blood vessels that goes to the kneecap, and we want to stimulate the circulation of that blood vessel to help it further. Okay, so just like that. Now, if you have a lot of swelling in your knees, this is also good because this gets the circulation going to reduce the inflammation. If you happen to be the type of person that get a lot of swelling in your legs overall, okay, whether it's your knee, your calf area, use it in this area. Plus, you can use it on the calf muscle to actually use what we call the muscle pumping action to help drive the lymphatic and the blood circulation to help to reduce the overall swelling. All right? So try that and you'll see excellent results. Now, some of you may be getting what we call patellofemoral joint syndrome, meaning you get pain behind the kneecap. Okay? It's not the ligaments, it's actually behind the kneecap. And that can be caused by imbalances of the muscle that control, okay, your leg movement. So if that's the case, I would treat the knee. So go to the section where I teach you how to treat knees. But I would also treat the muscle of the quadricep, especially this muscle here, what we call the vastus medialis muscle. So we put one pad there, okay, as one, as part of the treatment, and then we stimulate because we want to make sure the tone of this group and this group are normal, okay? If we do that, then the kneecap will stay in better alignment because you're pulling on it evenly. It's like different cables. If one cable is too tight, then the alignment is going to be off. But if both cables are equally, have equal tension, then the kneecap's going to track better, within the knee joint. So that's going to make it work better. So for the vastus medialis, and then the other group on the outside. So in the fancy name for this muscle group is the vastus lateralis. Okay. So basically, this is what we do. All right. Time-wise, usually I keep the treatment around 20-30 minutes because that's the amount of time you need to help to see and measure a big difference in improvement. And repetition, anything from 3 to 5 times a day or as you need it is fine. Again, don't worry about overusing. Now, if you had knee surgery or if you had metal implants in your knees already, you should be using the pain therapy system on your knee because it helps to break up the scar tissue, help to reduce the inflammation, and relieve the pain. Now, it is perfectly safe to use the pain therapy system on any area where you have metal. So if you have metal implants in your knees, go ahead and use it. It's good for it. Now, if you happen to feel like pins and needle, all you have to do, just move the pads over slightly, and then that's fine. Also, if you're on any medication, or if you're diabetic, you can also safely use this device because there's no chemicals involved. So you can use it for long term, as often as you like, with no side effects, only feeling good. Now, one exercise I always recommend for anyone with knee pain, especially if you have arthritic changes in your knee joint, is to passively swing your legs. Now, I recommend you swing it about 2,000 times a day. Now, that may sound like a lot, but it really isn't. And what I recommend is you just do about 100 each time and just do it throughout the day because it's going to really help to lubricate the joint and help to re-stimulate some cartilage, new cartilage regeneration. So watch my knees, all right? So very simple. Just support yourself somewhere, by holding onto something, and just gently swing that knee, okay? We're not working the muscle. We're just gently and passively moving that joint within its range of motion, okay? So full range of motion. I want the knee to be bent and then straighten out, but very loosely, okay, just like that. Very loosely, right from the hip. So it's very fast to do about 100. So to do 2,000 a day, it really is very simple. If you do that, it's going to really help to improve the overall health of your knee. So continue to do that, and you're going to see some big changes over time. Now, if you get pain in your calf muscles, or if your calf muscle happen to go into spasm, during the night, you can use my pain therapy system to help to relieve the muscle spasm. Also, if you get swelling in your legs, if you have ankle problems, if you have diabetic neuropathy, poor lymphatic drainage, this same stimulation on the calf muscle is going to help with all those different conditions. So we're going to use a large pads. In fact, use a large pads for your entire body except for your neck and face. So basically, two ways you can do it. You can put one pad on each side of the calf muscle, just like that, okay? And just turn it on. And again, it doesn't matter which mode you choose to use. They will give you the same results. But you do want to turn up to a point where you're actually getting some stimulation and muscle activity. You want muscle to contract and relax because it will squeeze the lymphatics, squeeze the blood vessel, and release them to help pump the fluid and pump the inflammation, from your lower limb. So it's going to be very good for anybody who suffers with circulation problem, and also anyone who gets cramping in the calf. Now, second pad placement is this. I can just put one pad behind the calf, and the second one goes behind my knee. Now, this position might actually be more effective for those of you who have what we call sciatic nerve problem. If you have pain or numbness that runs down from your back to your hip all the way down your leg, then you want to try the pads, in these two areas, because we want to stimulate the circulation of your sciatic nerve. Okay, so let me turn it on or turn it up, and then turn on. Again, we want to turn up to a point where we're actually seeing and feeling some muscle contraction and relaxation. And as you may have experienced by now, the sensation changes all the time because my device is programmed to modify itself so your body never get used to it. That's why this is one of the most effective pain relieving and self healing product there is around. Okay, and this feels really good, and this may allow you to get rid of that cramp and get a better night's sleep. Okay, so take care. Now, if you suffer with pain at the front of the leg or the shin area, or if you get what we call shin splint, now you need to rest the leg. Okay, if you're a jogger or a walker, just rest it a little bit, and then use a stimulation from the pads to help to restore good function there and to relieve the pain. Now, the first pad, just put it below the knee on the shin side. And then the second pad can go just about anywhere you want, but just a little bit below is good. Now, first pad should go on here because there is a nerve that exits from this part of the leg, and we want to stimulate that nerve in order to get the healing going on. And all you do, just turn it on. And then you want to turn it on to a point where you actually get muscle contraction and relaxation. And you can use any mode you like, and do it for at least 20 minutes. And you can repeat it 3-4 times a day until you see your maximum recovery. Okay? So that's basically what you need to do to relieve your shin pain and shin splint. But if you do have shin splint, that means you got some microfracture within the shin bone, so you should be taking some rest. But the stimulation is going to recover much faster. Now, if you are unfortunate and happen to suffer with stroke, you can use my device to help to stimulate the nerve and muscle to reactivate them, to re-educate them as much as you can. Now the results are going to be different for everybody who suffers with strokes because it depends on how much damage there is in the central nervous system. But what you do is you just put the big pads on any area that you're having trouble moving, okay? And you just turn it on and use it as often as you can. You can use it throughout the day. There's no harm in doing it too much. In fact, the more you do it, the better it will be. The least this device can do for you is to keep the muscle moving to prevent scarring of the tissue so that you can have some flexibility and some mobility. Now, some of you may be very lucky and actually find incredible response with the stimulation. I've seen that, okay? And with time, and I'm not talking about minutes or weeks, but within months, you'll start to see better and better muscle activity, muscle strength, and hopefully, you'll be one of those person who respond very well to this, okay? But use it, big pads, and I just want to let you know, if you happen to have stroke, or if you got diabetic neuropathy, where the nerve is, not conducting very well, when you first turn it on, you may not get this type of response. You may feel nothing, but keep it on, turn up full, and then usually after 10 or 20 minutes, as the nerve gets stimulated and activated, it breaks through some thresholds, and then all of a sudden, you'll start to feel the stimulation, and the muscle and the nerve will start to respond, and then you'll start to get the muscle contraction, relaxation. Okay, so don't just put it on and stop right away. Use it for 20, 30 minutes to see how your body responds, and continue to use it as you progress. Best wishes to you.